Thanks, Rajesh Merchandani. Well, that was an excellent presentation from the United Nations Foundation. Really fascinating to hear more about that COVID Solidarity Response Fund. And it leads us perfectly onto our next and final live panel discussion, which is on health and philanthropy and the COVID-19 pandemic. Welcome to everyone. Thanks very much for joining us. Let me introduce my panelists. We have Kate Dodson, who just heard there, joining us again. Kate builds partnerships as Vice President for Global Health at the UN Foundation, and looking particularly at delivering those sustainable development goals. We have Naina Batra, who is the CEO of the Asian Venture Philanthropy Network based in Singapore, whose membership has tripled under her leadership. We have Narayana Murthy, one of Asia's leading philanthropists, founder of Infosys, and Murthy sits on the board of the UN Foundation, and he was formerly chairman of the Public Health Foundation of India. We have Dr. Kayla Laserson, who is on the board of, who is the Deputy Director for Infectious Diseases and Vaccine Delivery at the Gates Foundation, based in India, so very busy at the moment. Thank you for making the time. Belinda Tanoto, Board of Trustees at the Tonoto Family Foundation. She's a passionate social activist who has spearheaded the foundation's investment in rural schools in Indonesia and also helped lead the COVID response. And we have Melody Song, who is a consultant for Global Philanthropic. Welcome to all of you. I'm going to start with a question actually to all of you, which is that every crisis is an opportunity. So how has COVID provided an opportunity in this area? And let me start with you, Murthy. Murthy, can you hear me?
Oh, okay. Yes.
Yeah.
Sorry. Well, first of all, thank you very much for this opportunity. The first and the foremost lesson that this pandemic has taught us is that a healthcare system that is insufficiently resourced and that is suboptimal in performance cannot create a strong and swift response when challenged by a public health emergency like this. Therefore, we have to raise the funding from 1.26% of our GDP to 2.5% by 2025, as promised by the Indian government. The second lesson is that governments must move from an administrative mindset to a management mindset. They believe that Singapore is a good example of this transformation because administration is about law, order, tax collection, and status quo. On the other hand, management is all about development, innovation, economic growth, benchmarking with the best in the world, and creating prosperity through jobs with good income. Let me stop here.
What about Naina? What about you? Is this crisis an opportunity, do you think? Oh, you've got to unmute.
Sorry. I do think it's an opportunity. In fact, building up, from what we heard before we came on the scene, I think before COVID, it's been incredibly hard to bring different philanthropic players who have different agendas together. So when there were disasters in the past in Asia where help was needed, like hurricanes or earthquakes or floods, we didn't see this opportunity to collaborate at scale. And in fact, the struggle of pooling of funds together was tough enough that individual foundations rather invested individually. But with the COVID crisis, we have seen across our members an open-mindedness and an eagerness to collaborate. And in fact, we've had more than 6 members in our network, all corporates, actually pooling their resources in a pooled fund. So I think one of the things we've seen is different actors across the philanthropic ecosystem coming together to collaborate so that they can reach rural, hard to reach urban communities. And I'm hoping that this collaborative spirit continues post-COVID into the other critical areas that are facing Asia.
Belinda, how has this crisis been an opportunity?
For sure. Amongst the chaos and the uncertainty and everything that's happening in Indonesia, I'm very heartened and encouraged by the speed at which our foundation partners are innovating and adopting change. Let me just give you a bit of context. Indonesia is very diverse. It has a vast landscape with 17,000 islands. So it's really important that the people on the ground are, despite the chaos, they're innovating and adopting technology. The teachers, the frontline workers are adopting technology at record speed. I think that in itself is an opportunity because we're only at the beginning of the innovation cycle. It gives us a golden opportunity to build back better, whether using digital technology or redesigning our process and systems, sort of building on Murthy's point about, how do we shift the governance role from administering to managing and leading, and how do we empower local leaders and strengthen local systems.
Kayla, from the Gates Foundation, how have you seen this as an opportunity?
Yeah, thank you. Thanks for this opportunity. I wanted to build a little bit on Naina. I do think we've seen just an incredible coming together of philanthropies and high wealth individuals and everybody coming together to really, especially right now for India, it's just been incredible. The diaspora, that kind of opportunity to bring people together has been really quite outstanding. In addition, I think the other opportunity has been seeing the importance of surveillance and how, disease surveillance, how important it is and how to build that strength within a country, as well as just leveraging and working with partners and really coming, to help in any way we can with the government, aligning with government priorities, as quickly as we can. I think there's been huge opportunity to do that and to really support actions that are happening and to bolster and support from all sides and using the kind of this ecosystem to do that. Thanks.
Kate Dodson from the UN Foundation.
Thanks, Christy, and really a pleasure to be with you all and on this panel today. And just to complement and maybe differentiate slightly from what colleagues have said so as to not repeat, Murthy already talked about that this crisis has given us a highlight and a spotlight on the underinvestment in healthcare, right? But it's also shown us how the world has underinvested in global public goods, the kind of common goods that every person, every country needs. And in a health crisis, we know what those are. Kayla just mentioned one. Surveillance is a capacity that's needed at a community level, but also at a global level. R&D for new vaccines, a capacity needed at a global level. And this crisis has certainly shown us that we have underinvested chronically in those kinds of global public goods. But it's also shown that there's willingness to invest in those global public goods. The COVID-19 Solidarity Response Fund that was just highlighted is just proof of that. Most of the resources that were galvanized, now it's $250 million and still counting, has gone to those kinds of global public goods. Global blood studies and antibody studies, global studies on vaccine efficacy, the global effort to curb misinformation and disinformation that is spiraling in social media and elsewhere. And we're at this next frontier of the pandemic where we still need that kind of urgent support for global public goods, especially in the context of things like vaccine equity. The global distribution of vaccines is horribly unequal right now. And we have to see that as a global public good, and philanthropy needs to crowd in together with government in order to be able to close that gap.
Yeah, it's interesting, that picture, isn't it? Almost as that COVID sort of providing almost like an X-ray, or sort of, providing us suddenly with this very stark picture of where the gaps are in our health systems and of course inequality in every single country in the world. For that, I mean, Melody Song, what sort of feedback have you been getting from philanthropists? Are you seeing a lot more interest in investing in the area of health? You need to unmute. Sorry.
Sorry. We work with clients all around the world, and we have noticed that health has always been an important cause to support in the past, but the pandemic really brought it up on the agenda for everyone. And we're seeing that support for health is increasing all over the world, as well as echoing our fellow panelists about collaboration. I think with COVID, each country is presented with the same challenge, but each country is also diverse with cultural and their political system. So this is an opportunity for us to actually research into how collaboration is done in different political and cultural systems and how is that different. So that's, to me is very interesting as well.
Murthy, as a philanthropist yourself, how did you personally respond to the pandemic?
Well, let me speak about what Infosys Foundation, the foundation of the company, and our own family foundation have done. Infosys Foundation has donated N95 masks and PPEs in very large numbers. They have provided funding for refurbishing a 150-bed hospital for handling COVID-19 patients in Bangalore. They have funded ventilators, oxygen concentrators, and other medical equipment to hospitals. They have provided monthly ration and salary to thousands of displaced migrant and urban workers. Now, let me talk a little bit about what our family foundation has done. We have provided funding to entrepreneurs to accelerate the delivery of ventilator multiplexers and oxygen concentrators to hospitals. We have provided funding for vaccine research. We have contributed to improving our public health services. We have also provided monthly ration and salary for displaced migrant workers. We have created a helpline to find hospital bed for many patients who need ICU beds and oxygen-enabled beds. These are some of the things that we have done.
And has the pandemic increased cooperation between the government and philanthropists?
Well, our PM has created a fund called the PM Cares. A large number of individuals and corporations have contributed to it. In addition, for the last 10 years or so, it has become mandatory in India for every company to set apart 2% of its net income for corporate social responsibility activities. For example, Infosys Foundation spends about $60 to $70 billion every year on activities that ameliorate the problems of our society. But being a large, poor country, even these measures are not sufficient. That's what I would say.
If you had to choose, do you have one lesson you hope that everyone will take away from this pandemic?
No, as I said before, the biggest lesson that I have learned is, first of all, we have to increase our funding for public health from 1.26% of our GDP, which is one of the lowest in the world. For example, even Pakistan and Sri Lanka and Bangladesh, they have set apart between 2.5 and 3% of their GDP. I mean, countries like US, I think US spends about 16% on healthcare, if I'm not wrong. Mm-hmm. I think Europe spends about 10 to 12%. So therefore, India has to spend more money, and that is in keeping with our promise to fulfill the SDG by 2030. And we have to get to at least 2.5%. And second, as I pointed out, I think this pandemic has shown that the mindset of our bureaucracy has to move from administrative mindset to management mindset. That's the most important thing.
Belinda, Tanoto, let me come to you. Why don't you give us a brief introduction of what the Tonoto Foundation does and how it has responded to the pandemic in Indonesia?
Sure. Our family foundation focuses on education throughout its life cycle. So starting from early childhood education in the first 1,000 days to supporting schools, teachers, principals, district officials, all the way to providing university scholarships. And during this pandemic, we really think about our response in two parts. So one is, of course, addressing the short-term needs, right? Providing the protective gear, rapid testing capabilities for the government in Indonesia, providing oxygen machines, but also we observed that a big part of it, the government also needs to think about the vulnerable communities that are experiencing all these economic shock. Like, what are we going to do in the medium and long term, right? So for us, it's really thinking about it in two parts. And for the medium and long-term things, we work very closely with the local governments to strengthen the local. So first, empowering the local leaders, because only they know what's happening on the ground. The second thing is providing them with the right data to make the decisions. So we rolled out this thing called, they call it e-HDW, online version of human development worker. So where there's a worker at every village in thousands of villages in Indonesia that collects data, critical data on the first 1,000 days, right? So whether the children have access to clean water, whether they're doing, whether the mothers are getting the iron supplementation when they're pregnant. So this then feeds into the local leaders so they can make the right decisions, empower them to make the right decisions. And we think this is really important, balancing the short-term need of reacting to COVID and even rolling out the vaccines and testing out and testing people.
So that's interesting. So basically, you've got philanthropy paying for research and data,
yes,
which policymakers and politicians can then use to implement policies.
Yes. So helping sort of address the white space on data and address the white space on capabilities and capacity building.
And I'm interested, you work closely with local government. Was that always the case, or has the pandemic somehow kind of speeded that up, accelerated that?
It's always been the case. I think about 4 years ago, we went through a transition. So I think our foundation did a strategic review about 3-4 years ago, and we said, if we want to be working at scale, we have to work with the government. And that was a shift in mindset. It was a tough shift. It obviously made projects slower, and we have to, because now there are multiple parties. And when you say government, it's actually not just local government, there's district government, and then there's the central government, right? The ministry. So it's multiple parties and multiple layers of the government that you have to align the interests of. It's definitely slower, but we know that this is the only way to be sustainable.
Requires patience, I imagine.
Yes.
And finding who the right person is to talk to always, isn't it?
Actually, and to be honest, I have to be, it's also a new skill we had to acquire, right? How do you manage partnerships? That's a new skill. It's not something that comes very naturally in a foundation, especially when we came from the business background where, when in the business, we move very fast and we do things very focused. But in the foundation, we have to switch to a collaborative mindset, a partnership mindset. So that was a big shift that we had to have about 3-4 years ago. But to be during COVID, actually, that sense of urgency that everybody has been talking about, it was the first time when we worked with the Ministry of Social Affairs, for example, it was record-breaking time for them to come up with a new module to train the frontline workers. Like normally it would have taken us 10 months, and that module came up in 2 months, for example. So I think that sense of urgency is creating this opportunity also.
And did you find yourself collaborating more with other foundations and other philanthropists than you had in the past?
I would say for sure, because I think when there's this something, in Singapore, we'd say nobody is safe until everyone is safe, right? So it's really that sense of urgency that we see in Indonesia. Even when we deliver the rapid testing, we collaborated with a few foundations. And also going back to addressing the local needs, because everyone is scattered in different parts of Indonesia. I think it's really important to coordinate and understand and sort of have a bigger picture of what's happening. I think that was really important. So that sense of urgency and having boots on the ground in different places was really helpful.
Thank you for that's really interesting. I'm going to come to Kayla Laserson now. Thank you, Kayla. I bet you're having an incredibly busy time at the Gates Foundation in India. Perhaps you'd like to start with a brief overview of the current situation and that you're operating in.
Sure. I mean, I think everyone has seen the numbers in India, and it's been quite dramatic. Things were quite low in February, mid-February. There'd been a pretty high peak in September, October, and had come down in November. Through December, January, February, things were quite low. So, and through seroprevalence studies, many people had antibodies. So many people in Delhi, it was 56% had antibodies. So there was a feeling of many people have been infected, and perhaps there's a lot of immunity. And so I think it was a bit surprising. I think there was always the idea that another peak would come, but I think this peak caught everyone off guard in terms of its ferociousness. And so it started in, really kind of, if you look at the numbers, it really started mid-February, but I think the realization really came in March where things were going. And so it's just been very, very hard, very hard, very tragic for many people, and up to, 400,000 cases a day, 4,000 deaths a day. It looks to be peaking a little bit in the metros, but we know it's still continuing in the rural areas. And it's hard to know exact numbers in all of these places. So things are tough. It's been a very tough time for everybody. As the foundation, we've been really honored to be able to be here and be able to help and support the government. And a lot of the work that we've done has been very much about response. So
yes, because I was going to say, for the Gates Foundation, how did you have to sort of pivot your strategy generally in response to COVID-19 compared to what you were doing before?
Yeah, so we were able to, what was great is we have many partnerships within India with different partners and of course with the government. So we were able to pivot quite quickly and leverage those partners to start working on COVID. And it included a big focus in UP and Bihar, which are two states that we've spent a lot of effort working in. And it included everything from building facilities to testing expansion. Now we've had to move more into kind of getting oxygen concentrators, oxygen generators, all of the kind of response efforts, PPE, rapid tests, that kind of expansion, clinical care, building up of facilities and increasing ICU beds and that sort of thing. So really working to ensure the response is there. And partners that we have had working on other issues, say routine immunization or such, they've pivoted to COVID, but at the same time, keeping their eye on essential health services, because those also have to continue. And after the first wave, that bounced back quite quickly with our partnerships, and they will bounce back again, tuberculosis and other infectious diseases. But we've also been supporting surveillance, including genomic surveillance and sewage surveillance to bring in new technology and innovation. And being the foundation, we've been able to be nimble and quick and try and help where we can and be very responsive to government needs. Everything from supply chain to surveillance to epidemiology. So really trying to do everything as needed when needed as this evolves so quickly.
And what lessons would you say can be learned from this that can possibly be applied going forward?
I think, there's so much preparation that can be done. The pandemic preparedness, ecosystem has to be strengthened, but also this kind of, you have to be nimble, you have to be quick, and you have to expect the unexpected and look at the data, watch the data and see where things are going and be ready to respond. And I think as a foundation, we were able to respond very quickly. And I think that's a lesson, is the ability to respond quickly, but also to build the infrastructure and to build the ecosystem.
Kate Dodson of the UN Foundation, how do you think more generally the pandemic has impacted on relationships between philanthropists and government? We've heard some interesting examples there, but broadly, what are you seeing?
Yeah, it's a great question. So I think drawing on some of what others have said, philanthropy has really filled in equity gaps where public sector dollars haven't been sufficient or haven't been fast enough, or frankly, both. And that can be, the kinds of examples that Murthy gave of supporting, hospital beds and the kind of accelerated access to bed nets to N95s, or like Kayla had just mentioned in India. Humanitarian and crisis contexts are especially where the speed of philanthropy can matter relative to the speed of government funding. It sometimes doesn't make a difference in terms of scale, right? Because often government funding will crowd in eventually, but the speed factor, which I think various speakers have also highlighted, is really important in a refugee setting, a refugee camp setting, or with other kind of vulnerable and populations in crisis contexts. It also makes a difference in a really local context, local food security issues, local health issues like Belinda had highlighted on access to water and things where that, closing those equity gaps is where philanthropy can really make a difference. But I also really appreciate what others have said about policy innovation and policy change being a really important role for philanthropy. Belinda's example, I think, was a great one. Research and innovation and kind of pressing the envelope on what are the right kinds of solutions, and then researching those, documenting those, and then helping a government scale. I think that's a really important interface between philanthropy and government. But I'll also say another, civil society organizations, play a really important role in encouraging good governance and encouraging transparency and accountability. And so as others have highlighted, those are key requirements of a government to its citizens, but often it takes philanthropic push through civil society organizations in order to be able to encourage governments to play that kind of role, to be accountable to their citizens.
Well, of course, philanthropists can take risks, can't they? That governments can't. And lead the way that way. Let's talk about the third UN Sustainable Development Goal, which is to ensure healthy lives and promote well-being for all ages. In what areas do you perceive the biggest gaps to be? Where would you like to see more philanthropic money going and leading the way?
Kayla just hit on one, which is the global, preparedness ecosystem for health threats. I mentioned earlier that the world has underinvested in those kinds of capacities. And I think we're now at a shining moment where the urgency will fade over time if we don't address this issue of chronic underinvestment and health preparedness writ large, at community level, at country level, at global level. So I think that's one key aspect. But the other one that others have also hit on is, underlying SDG 3 around health and well-being is the notion of universal health coverage. It's been elusive to most governments and most communities that they don't have equitable access to quality health services that are affordable and that don't lead to financial impoverishment. 100 million people are pushed into poverty every year due to health expenses alone. And this pandemic has taught us that people don't have reliable access to quality health services, and that health services have been wildly disrupted in many contexts because of the pandemic. Kids aren't getting their basic immunization. People aren't getting access to antiretroviral therapies. Women aren't getting access to family planning. Now, there's been gains made in recent months to try to recover that. But there is an urgency now for both political will and financing to help support countries and communities achieve that goal of universal health coverage.
And is there any evidence to show that, philanthropists can show the way and then governments will follow?
I think there's plenty of evidence. We just heard that from Belinda in Indonesia. And, you think about something like digital health solutions. How can you equip frontline health workers with better tools to diagnose, to treat, to access information in virtual consultation, to manage supplies in their clinics. And those are places where, philanthropy has invested for the past 10 or more years as kind of some of the leading tip of the spear on digital solutions for health. But now the public sector is picking up on best practice, on innovation, and public sector is going to be necessary to scale solutions like that, right? It can't be done on the back of philanthropy alone. But I think we've shown in the digital health space that innovation can spark government change and kind of onboarding of new solutions at scale.
Now, as you discussed in your case study, there was a lot of corporate support for your Solidarity Response Fund that the UN Foundation set up for COVID-19. Do you think we're going to broadly see a shift in the sector with increased philanthropic support from corporates post-pandemic?
Well, I sure hope so. And Naina highlighted earlier that there's a spirit of collaboration among philanthropies, right? That it's not a sense of kind of territoriality or turfism, right? That philanthropy, including corporate philanthropy, can work in partnership with each other. And I hope that's an innovation that sticks and one that in fact accelerates the kind of collaborative philanthropy that Naina highlighted. But one of the things that I think, and we highlighted this a little bit in the case study that we just showed, is that corporates have a lot more to contribute than just writing a check out of their CSR budget. The Solidarity Fund created and enabled a thriving ecosystem where companies could show a lot of different assets in ways that they could help stimulate philanthropy, right? So that includes, many retail companies created point of sale arrangements where if you buy a certain gift or buy a certain thing, a percentage of the sale would go to the Solidarity Response Fund. Online gaming companies set up in-app giving opportunities. Virtual concerts were designed to help raise money. And so there were lots of innovations that corporates came up with. WeChat had this really great app option, and Facebook had a giving platform. So there were really great options all over the place that once we kind of enabled that ecosystem to thrive, it created a lot of corporate to corporate partnerships around that, and it created a lot of diversity and ways for giving to be stimulated.
Naina, you're the CEO of the Asian Venture Philanthropy Network. Why don't you talk us through the origins of the network and how it has grown since, and I think you became CEO in 2013.
Yes, I did, Christy. And so the AVPN actually came out of Europe. Our sister network was founded in 2005, and it was founded by an American gentleman who was inspired by venture capitalists in the United States who were looking at a new way of doing philanthropy. And he set up EVPA in 2005 and then came to Asia in 2011. It's been an interesting journey, and literally AVPN has grown very, very steeply, partly because there's been a huge generation of wealth in Asia. We have the most number of billionaires in Asia, the most number that are created year on year. But yet, it's also a continent which sees more than its fair share of disasters, whether they are climate-related disasters, health-related inequalities, income-related inequalities. And this pandemic has really exacerbated that. So I think part of the thing the AVPN does is it brings unusual actors together. Both Kate and Kayla and Belinda and Tonoto Foundation is a member of ours, have all talked about collaboration. And it's actually looking at unusual allies, right? Corporates collaborating with each other, foundations, private philanthropists like Murthy collaborating with corporate foundations and with government, private philanthropists like the Tanotos collaborating with government. And what AVPN does is it brings all these different groups together to see how can you actually maximize impact. And that's what, we find that I think that there's been a much bigger awakening that you can't do this alone. The problems are just too big, at least as far as Asia is concerned, for any one individual, one foundation, or one government to actually really try and bridge that gap. And I think that's another reason why a platform like AVPN has done what it's done, because it really brings these different people together. And we saw, even with the first stage of the pandemic last year when it broke, our members in a very short period of time actually aggregated more than, I think it was about $10 billion to give towards the pandemic in Asia, largely by collaborating with each other, by setting up platforms in different countries. There was a platform called Ugnayan in the Philippines, where you had 10 corporates that came together to look at how would they feed low income communities in Metro Manila through the series of lockdowns that are still continuing till today.
You talked earlier about the network was set up to look at new ways of philanthropy, a new approach. Could you expand a little bit on that within the current context?
No, absolutely. So, earlier on, I mentioned a collaborative pooled fund. And again, what has been interesting when people come together in pooled funds, I find that they are much more braver. If it's a corporate foundation, we have 6 in this pooled fund. When they're in their own corporate foundations, they're very much bound by what that corporate wants to do. But when they come together and pool their funds, and Kayla, the Gates Foundation is one of the foundations that has actually come in and joined the pooled fund, they are much more open to doing something more innovative. So this pooled fund is looking at healthcare recovery and is designed to give unrestricted operating expenses grants to organizations that are going to be needing it, much after the pandemic, basically at healthcare delivery organizations. We've all talked about the fact that public institutions are lacking, that healthcare delivery organizations are lacking. And I think by coming together in different types of innovations, we saw that in Singapore. In fact, the Community Foundation of Singapore put up a Science Fund, and I think they were not expecting it, but they ended up raising close to $750 million in individual donations for Singapore. So I think that has helped, really support innovations. So Singapore is actually set up a social impact bond with some of that money, looking at mental health. So there's been a lot of different things that have opened up as a result of this kind of funding coming together. Unfortunately, in a situation like this, but hopefully this will continue.
And I mean, just finally, what are the next steps for your network after the pandemic? How are you going to build on this response?
So I think, if you really look at it, we are in 2021, we have 9 years. And, the SDGs are, while some countries have done well, like Singapore, other countries in Asia are far behind. And the pandemic has pushed it even farther behind in terms of how we are going to reach here by 2030. So we actually have a very ambitious plan. It's our 10th year. It's, how do we look at this as Asia's decade? How do we look at this as Asia's decade to build back more inclusively, in a more equitable fashion, to make sure that no one gets left behind, to make sure we have adequate healthcare, adequate education, clean drinking water, equal opportunities for women. The list is endless. But we need to focus on collaboration. We need to focus on how we come together, and most importantly for us here in Asia, especially, we need to focus on how we work with government. Because as Belinda said, we can't scale if we don't work with government. We have some of the most populous countries in the world in our continent. So whether it be Indonesia, whether it be India, whether it be Philippines, unless we work with government, we are not going to be able to make a dent. So that's the intention of the network, is to keep trying to bring different actors together and push out innovative solutions that people can come together on.
Melody Song, what research into giving and the pandemic would you like to see in future? And what do we need to know in our approach to future disasters, for instance?
So I think this has been a really wonderful and lively conversation, and it also bringing back the learning from previous sessions for me is the interconnectedness between all of us, like environment, how it's connected into the health crisis, and how the health crisis also highlighted inequality around the world. So I really want to see some of that interconnectedness to be examined a little bit more, as well as, like everyone was saying, the collaborations amongst people. This is a unique challenge that everyone faces, and how are we documenting and study and make things better in the future? And definitely a call to research for that, and also how to fix the problems and gaps that have been identified through this crisis.
Now we've got 5 minutes of our panel left, and so I'd like to sort of scoot round all of you for some sort of final points that you feel that you haven't been able to make, and now is your opportunity. Murthy, starting with you, have you got a final point on this issue of health and philanthropy, message to get out?
Well, I would once again come back to my earlier point, and that is we have to get to a management mindset. Management is all about good forecasting. It is about open-mindedness. It's about new ideas. It's about good feedback. It's about citizen focus or customer focus, in this case, citizen focus. It is about transparency. It is about accountability. It is about doing what if and scenario analysis. It is about speed of decision making. In other words, it's about benchmarking ourselves with the best in the world, to learn from other people who are better than us. I personally feel that if the countries that have been in a very big way, countries that have suffered a lot, if they were to think very carefully and learn from countries like Singapore. I mean, Singapore has done a great job in transforming itself from an administrative mindset to a management mindset. I personally feel that we would be in a position to avoid the next disaster.
And you mentioned Singapore. You're referring to the matched funding, which has been very successful, amongst other things.
Sorry, say it again.
I said Singapore has matched funding, doesn't it, between government and philanthropy? Is that what you're referring to?
No, I think funding is not a big issue certainly in India, because as I pointed out to you earlier, 2% of the net income, net profit of every corporation has to be dedicated to corporate social responsibility. Funding is not our biggest problem. Our biggest problem is good governance. Our biggest problem is moving to a management mindset. Our biggest problem is speed of decision making. Our biggest problem is listening to experts. Our biggest problem is being open-minded to learn from other cultures, other countries that are better than us.
Okay. So Murthy, we've got a couple of minutes left, so I just want to bring in the others. Belinda, in a minute, have you got a final message out there for other philanthropists?
Sure. I think for me, in addition to additional funding for healthcare, for sure, I think how do we enable and showcase innovation? I think that's really important, right? Because even additional funding, because the needs are so vast, we have so much to cover. How do we really enable that innovation to thrive? And we're only at the beginning, we're only at the beginning with the digitalization and everything that's happening. So how do we harness that energy to really? And I think going back to what Kate was saying, or Kayla was saying, I think foundations are really able to move more faster and more nimble in innovating for the government, and then sort of sharing those solutions with the government. I think the foundations really have to step up on their innovation and thinking about the future and how to build back in a newer way.
Yes. I'm afraid we've run out of time, actually, so I can't come round to all of you, but I'd just like to say thank you so much for all your time and consideration. That was a fascinating conversation with lots of insights, and I'm sure for many people watching, it'll be one of the first times they've been able to actually kind of hear and reflect on the role of philanthropy and how philanthropists have stepped up in this current crisis, and indeed the organizations they support.